Today we have gathered here for a one-day research dissemination workshop which is on women and reproductive health with special reference to women with Polycystic Ovarian syndrome. The research was titled as the lived experience of women facing PCOS in Kashmir. PCOS among women has emerged as one of the major health issues. It has impacted the life and living condition of women and has affected a woman not only physiologically but socially as well as socially and economically as well. The incidence of problem has made researchers and practitioners to work and conduct research extensively on this particular area. Department of Social Work had tried to work upon this particular issue. Maybe we'll be able to address the issue at a grassroots level. The issue demands the conduct of research dissemination, sensitization, awareness, referrals, and it also, as per the research, there's a more prompt diagnostic techniques required for this particular issue.
If you see the prevalence of this problem, in India it is out of 5 women, it is prevalent in 1. And more significantly, in our Jammu and Kashmir, there was a ICMR task force research done. And they have found that it is prevalent to around 28 to 30% of women in Jammu and Kashmir. Shockingly, it is highest in the world. Why it is so? What are the reasons? What are the causes? What can be done? This is something I think where we need to look into because the prevalence of this problem is very high. And we as at the Department of Social Work, we may not have extreme kind of expertise on the problem so far as the medical model is concerned. But our work starts after the diagnosis of the problem has been done. What are the social and the cultural and economical and other psychological problems which these individuals face? And while we have done this study, in the last 2.5 years, we have been approaching to various hospitals after being diagnosed by the endocrinologist, the doctors. We would try to understand the journey of these patients. It's not only diagnosis that a particular woman has a PCOS, but what after that has been their journey. What are the issues they have faced? What are the challenges they have faced? And that's what we have tried to tap in the research, of which we are going to give a detailed lecture in the next session, that what are the findings and where we need to look into.
When we talk about PCOS, we know that this how biopsychosocial model has to be taken into consideration, because I see it as an invisible struggle, because a struggle which mostly we do not acknowledge, because there are many elements which we all know, like an expectation that only a married woman visits a gynecology section is again a myth which needs to be covered. I have seen lots of parents struggling taking their teenage daughters to a gynecology with the myths and stigma which is there. I have seen myself in many clinics, like how uncomfortable the girls are and how uncomfortable the parents are when they take their teenage daughters to any gynae, to any obstetrician, because we have seen that we don't have specialized sections or specialized clinics and specialized wards where we focus on the adolescent girls or the young women related to PCOS. And most of the time, the mothers, the parents do not want their daughters to visit the clinics because we have a limited, that kind of understanding of gynecological issues and reproductive health. We mostly believe that the reproductive health cycle starts once you marry and then. But we need to understand that we have these days young girls, just 12 years, 13 years, 11 years, experiencing a lot of PCOS issues, which needs to be addressed. And that's why I believe the community awareness needs to be more discussed in public, and a multi-pronged approach needs to be worked out, because it's not only the doctors but also the counselors, psychosocial counselors, the therapists, the support groups which can play a very important role.
PCOS is a challenge, well documented in literature. When you read it, the quantum of fear in the mind of these young girls increases. It's really a public health problem. 6 to 13% of the world population is affected, and the prevalence varies in different countries. But one thing is there, that the fear associated with the disease is more dangerous and more dreaded than the disease itself. This time when we are talking and beginning to talk about this disease, I see the signs of fear on the faces of these young scholars and researchers. But I assure you, the moment we talk about this disease very fairly, sincerely, and in an unbiased scientific way, and you will leave this hall with happiness, and you will feel that the strength God has given you is far more important, far more greater than the challenge of this disease. Therefore, one thing very important, I want to quote the saying of Prophet Muhammad sallallahu alaihi wasallam. उन्होंने फरमाया है कि अल्लाह ताला ने दुनिया में तब तक कोई बीमारी नहीं भेजी जब तक न इस बीमारी के दुनिया में आने से पहले इसका इलाज नहीं भेजा हो. So there is a treatment for this disease. Maybe we are not knowing it. All of us need to get united, and we have an integrated health development model. We have been working on that issue. The most important thing is that if we look after our health in a better way, if we improve the quantum of our health, the war of different diseases, be it COVID, be it PCOS, we will win that war, be it tuberculosis. So, when we will talk a bit in detail in later hours, we have an integrated health development model. We have worked it in Udi, Baramulla, Gurez. Now I am working it for the last 1 year in Union Territory of Ladakh. We have extensively worked in Kargil. We are taking this concept there for all diseases, that in near future we want to see a disease-free and a healthy Kargil by the concept of democratization of health, putting the health of the people into their own hands, the health by the people, for the people, of the people. In the same way, these young research scholars, the girls who are faced with this problem, if we go by the concepts of democratization of health, we give their health into their hands, and they can only look after their health in a better way when they know it. And to know it, the University of Kashmir, the Department of Social Work is doing a commendable job to get this topic.
The important inferences which have been drawn out of this piece of research work, which have been conducted under the supervision of Dr. Adil and other faculty of the social work department, they will be proving a long way in formulating the important strategies so far as the reproductive health, particularly when we are talking about the PCOS. Because out of this study, it has emerged as one of the important areas of concern so far as the reproductive health of the woman is concerned. And the statistics which have been presented here is very glaring, and it is very concerning. I hope this piece of research will be shared with other collaborative partners, like we have a number of excellent medical institutions in the UT of Jammu and Kashmir, so that a comprehensive policy will be formulated to address this issue very effectively in order to reduce the incidence of this disease, particularly in this region. And I hope Dr. Adil and his team is doing a great work. He will be conducting a number of sessions with these collaborating institutions, and he will be coming up with the policy paper that what are the different preventive measures or the initiatives which could be taken at the UT level, where we could formulate a very effective model so that the burden of this disease could be reduced effectively within the shortest possible period of time. Then another statistics which was very glaring, which I have confronted even today in the morning, that India is just one of the leading countries so far as the cervical cancer among the women is concerned. It has got the highest cases in the world that is directly related to this reproductive health. So that speaks volumes so far as our healthcare system in the country, despite the fact that we are making tall claims, as supplemented by the statistics or the inferences which have been observed by the team of the Dr. Adil in this region as well, that corroborates this alarming statistics, not only at the regional level but at the country level as well. Having said that, Professor Majid Saab is sitting here, he is the active collaborator in all these programs. I believe that we will be able to just come out with a very effective policy paper so far as the reproductive health, particularly this PCOS is concerned. And I believe, inshallah, that Kashmir University will be taking a lead in just formulating the policy paper that what is to be done on different fronts in order to curb this one of the important problems, which is a glaring health problem, particularly with women.
Professor Ganai, and all the research scholars, paper presenters, students, staff, our alumni of the Department of Social Work, our support staff for their important contributions. I also thank all the volunteers who have been behind the stage.